Thank you for the organizers for giving me an opportunity to tell you a little bit about what we're doing in Genome Canada. And I need to give you a 2-minute sort of, I'm assuming that you're not all genomics literate, so I'll give you a 2-minuter and then another minute on talking a little bit about a laundry list, unfortunately, of things that we're thinking about to help the innovation agenda, hopefully. So I think I'm in control of this. So basically, Genome Canada was set up 10 years ago, a non-for-profit organization. We're in, obviously, the business of genomics, everything to do with DNA and across all sectors of life sciences. Funded by the Government of Canada through Industry Canada, which we leverage up. So over the last decade, we've had $915 million invested in this field from Industry Canada, and we've leveraged that up to $1.9 billion over the last 10 years. So quite a big investment in a focused area of technology in the life sciences, health, agriculture, fisheries, environment, forestry, etc. We also have the gels thing at the end is our insistence that when groups get together and design projects, genomics projects, they integrate societal or legal or social aspects of their project. And this is to have a sort of seamless direction from the research to the end user, and no matter where that end user exists, whether it be in healthcare or in the wild fisheries or aquaculture or agriculture industries. And we're really looking at the full range of activities from discovery to translation. And we are in the business of large-scale science. Genomics is a large-scale business, and a lot of our projects are from the $10 to $15 million envelope for each project. So we are also a community that is coordinated across Canada through regional centers. We have 6 of those. And as technology is a big piece of what we do, we also have science and technology innovation centers that are focused in genomics, and we have 6 of those across the country. So when you look at the funding, 46% from the federal government through Industry Canada, and then you can see the pie chart, various other fundings coming from institutional, industry, international, and provincial sources. So this initiative has really transformed Canadian genomics, the landscape of genomics in Canada, from a follower, because we were not involved in the Human Genome Project, to actually a leader in several areas. And we are the leader in some aspects of fish genomics. We have the best platform in salmonid genomics in the world, conifer trees, environmental microbiology, and of course in certain aspects of the health agenda. So 70% of Genome Canada's portfolio is in the health area, and the sort of big drive here is the fact that it took about $3 million and 10 years to sequence the first human genome, and now you can do this in a couple of days for about $10,000. In a few years' time, you'll be able to do it in under an hour for maybe $100. And so this is a huge driver for change in many areas of healthcare. So how are we going to use this technology in the healthcare industry, and how on earth are we going to integrate it, given all of the complexities that you've heard today of what we're doing? Well, there are already examples of Canadian discoveries that have had, in genomics, that have had impact on what we do. So one study on the genotyping of families that had unfortunate sudden death of infants discovered that nursing mothers some of them were fast metabolizers of codeine where they were prescribed after having given birth, and that codeine was fast metabolized into morphine and killed their child. So that discovery, Canadian discovery, from groups working across the country, gave rise to, I think 18 months ago, a label change, both in the FDA and in Health Canada, to not prescribe codeine to nursing mothers. Another study from the Atlantic Medical Genetics and Genomics Initiative, funded through Genome Canada. This was looking at families where young men, well, under 50, certainly young, were just falling over dying. And they discovered through genome-wide scans that they had a defect in one single gene. And now those males in those families are walking around with defibrillators in their chests. Fantastic study. So you have, in those two cases, you have study and you have impact. Now, is that innovation? It's not commercialization, but I think it's of huge value. And I think it's where you see the amazing power of some of these tools that are now available to us. And obviously, as you know, you've heard before, Canada ranks right up at the top, whether you're looking at stem cells, cancer, autism, transplantation, infection and immunity, where very strong genomics work is being done. So here's the laundry list, and it's a tricky one because it is so complex. The genomics train has left the station, and it is now up to us, all of us, I think, to determine how this is going to be used. There is going to be a lot of, from the public and patient groups and advocacy groups, a drive to use some of these technologies. But we need a receptor capacity within the health system to have, and somebody talked about this before, a technology pull. The technology push will not work alone, and unless we set up a parallel system, which will not happen. So we do need a technology pull, and you can only do that if the people within the receptor understand what's going on. So I think there's going to be a huge implication in the private sector, a huge involvement rather than the private sector, a huge educational training of healthcare professionals in the space. I think the electronic record is, I know, a thorny subject. It's been difficult to implement in several jurisdictions, but I think it's really, really important. And as I say, the role of patients and advocacy groups in this space is very, very important. And along the lines of when people were talking about, well, how on earth are we going to afford to treat patients more and more individually with this molecular stratification that we can do now on cancer and cardiovascular disease and other diseases. Well, the only way we can do that is if we keep most of the people healthy. And that, it sounds trite, but I'm afraid when you're dealing with the expensive chronic disease, a lot of which is preventable, we need to have much more money going into prevention. And we need to strongly encourage behavior change. That, for me, means, in some instances, legislation. So if you look at what happened to the issues around smoking, it was only essentially legislation banning smoking in public places in many countries in the world now, that that legislation has driven huge changes in not only in human behavior, but as a direct relationship to decreased disease, pulmonary disease in many countries. And that didn't take long before you saw it. So I happened to be in Ireland when that law was passed in Ireland, which was the first country to instigate that law. And the impact in pulmonary clinics was seen by year 1, 2. It was just so dramatic. So I'll leave you with that, and thanks very much for your attention.